I'm Dr. Neil Galindez. I practice at HCA Florida Heart and Vascular Care. Cardiac valvular disease encompasses any of the valves in the heart. The heart has 4 valves between the upper chambers and the lower chambers, and between the lower chambers and the great vessels that go out to the general body and to the lungs. Those are the aortic valve and the mitral valve, and the tricuspid valve and the pulmonic valve. We usually see disease of valves when patients age. Some of us tend to build up calcium in the leaflets of the valves. If you can imagine a circle with 2 cavities opposed to each other, in the middle you can put in that circle a valve that has tissue that works just as a door. Just imagine 2 doors with hinges that open and close. The valves should be one direction only. They allow to have blood to go from one chamber to the next in the heart. When any of those valves get stiff or gets calcium deposits on those doors, on those leaflets are going to get very stiff and will not be able to either open well or close well. So in the cardiac cycle, when the blood has to go from one chamber to the next, the valve will not open well or will not close well, and the blood will go in one direction, but then because it's not closing well, it will go back in the same direction. And this is against efficiency. And that's what we call valvular disease. Any valve can get affected in the heart, most likely the aortic valve and the mitral valve. And for that, we do surgery. We have surgical interventions to either fix those valves. If we can preserve the own tissue of the patients, we'll do it. But if we cannot, because the valve is very damaged already and there's no way to fix it, then we have to replace those valves. Those valves are replaced with artificial valves made with either plastic and special metals, or valves that are made out of animal tissue.